Cocaine is a powerful stimulant drug. It creates a surge of energy and euphoria. This is followed by a crash. This crash brings on cravings and withdrawal symptoms. Cocaine works by interfering with the brain's reward pathway. This pathway involves a neurotransmitter called dopamine. Dopamine is released when we experience pleasure. This pleasure can be from food, sex, or social interaction. Cocaine blocks the reuptake of dopamine. This means more dopamine stays in the synapse. The synapse is the gap between neurons. This leads to an amplified dopamine signal. This is what causes the intense high. However, repeated cocaine use disrupts the brain's natural balance. The brain becomes less sensitive to dopamine. This leads to tolerance. This means you need more cocaine to achieve the same high. This cycle of addiction can be very difficult to break. Cocaine's effects are not limited to the reward pathway. It also affects other parts of the brain. These include areas responsible for decision-making, impulse control, and memory. This can lead to poor judgment, risk-taking behavior, and difficulty learning. Cocaine's immediate effects on the central nervous system are dramatic. Users experience heightened alertness, increased energy, and a sense of euphoria. Pupils dilate, heart rate and blood pressure soar, and breathing becomes rapid and shallow. However, these effects are short-lived, typically lasting 30 to 60 minutes, depending on the method of administration. The crash that follows is characterized by intense cravings, agitation, anxiety, and depression. Chronic cocaine use leads to long-term changes in the brain's structure and function. The brain's reward system becomes dysregulated, making it increasingly difficult to experience pleasure without the drug. This can contribute to depression, anxiety, and anhedonia, an inability to feel pleasure. Chronic cocaine use can also lead to cognitive impairments, including memory problems, difficulty concentrating, and impaired decision-making abilities. Moreover, long-term cocaine use increases the risk of seizures, strokes, and movement disorders. These problems can arise from cocaine's vasoconstrictive effects, meaning it narrows blood vessels, reducing blood flow and oxygen supply to the brain. This can damage brain cells and increase the risk of these serious neurological complications. Cocaine is a potent stimulant that places significant strain on the cardiovascular system. When cocaine enters the bloodstream, it triggers a surge in adrenaline and noradrenaline, hormones responsible for the body's fight-or-flight response. This leads to a rapid increase in heart rate, blood pressure, and heart contractility. Blood vessels constrict, further elevating blood pressure and forcing the heart to work harder. Acutely, cocaine can cause chest pain, irregular heart rhythms, and even heart attacks, particularly in individuals with pre-existing heart conditions. The combination of increased oxygen demand by the heart muscle and constricted blood vessels supplying the heart creates a dangerous scenario that can lead to myocardial ischemia, where the heart muscle is starved of oxygen. If blood flow is not restored quickly, a heart attack can occur. Chronic cocaine use significantly increases the risk of developing long-term cardiovascular problems. These include hypertension, atherosclerosis, and cardiomyopathy. Over time, these conditions can lead to heart failure, stroke, and other life-threatening complications. Cocaine's impact on the respiratory system is equally concerning. When snorted, cocaine irritates and damages the delicate tissues lining the nasal passages. This can lead to nosebleeds, chronic runny nose, loss of smell, and even perforation of the nasal septum, the cartilage that separates the nostrils. Smoking crack cocaine, a particularly potent and dangerous form of the drug, directly damages the lungs. Inhaling the hot smoke from crack cocaine irritates and inflames the airways, leading to bronchitis, asthma-like symptoms, and an increased risk of respiratory infections. Crack cocaine smoking can also cause a condition known as crack lung, characterized by severe chest pain, shortness of breath, coughing up blood, and difficulty breathing. This condition is often accompanied by fever and a rapid heart rate, making it a medical emergency. Long-term cocaine use, regardless of the method of administration, weakens the lungs' natural defenses, making users more susceptible to pneumonia and other respiratory infections. The chronic inflammation and damage to the airways can also contribute to chronic obstructive pulmonary disease, a progressive lung disease that makes it difficult to breathe. Section 5. Gut reactions. Cocaine's effects on the digestive system. While cocaine's effects on the brain, heart, and lungs are well documented, its impact on the digestive system is often overlooked. Cocaine disrupts the normal functioning of the gastrointestinal tract, leading to a range of uncomfortable and potentially serious problems. One of the most common gastrointestinal side effects of cocaine is abdominal pain. Cocaine's vasoconstrictive effects reduce blood flow to the digestive organs, leading to pain, cramping, and discomfort. This reduced blood flow can also impair the digestive process, leading to nausea, vomiting, and constipation. Cocaine use can also damage the lining of the stomach and intestines, increasing the risk of ulcers and gastrointestinal bleeding. Chronic cocaine use can lead to more serious digestive problems. These include ischemic colitis, a condition where blood flow to the colon is reduced, leading to inflammation, pain, and tissue damage. Cocaine use has also been linked to an increased risk of pancreatitis, a painful inflammation of the pancreas. Section 6. Strained filters, cocaine and the kidneys. The kidneys, responsible for filtering waste products from the blood, are not immune to cocaine's damaging effects. Cocaine's vasoconstrictive effects reduce blood flow to the kidneys, putting them under significant strain. This can lead to a condition known as cocaine-induced renal ischemia, where the kidneys are deprived of oxygen and nutrients. Over time, this chronic stress can damage the delicate filtering units of the kidneys, known as nephrons, leading to kidney damage and even kidney failure. Cocaine use can also lead to rhabdomyolysis, a breakdown of muscle tissue that releases harmful substances into the bloodstream, further damaging the kidneys. In addition to these direct effects, cocaine use can indirectly harm the kidneys by increasing the risk of high blood pressure and diabetes, two leading causes of kidney disease. Cocaine-induced seizures and heart attacks can also damage the kidneys by depriving them of oxygen. Section 7. Hormonal havoc. Cocaine's disruption of the endocrine system. Cocaine disrupts the delicate balance of the endocrine system, the body's network of glands that produce and regulate hormones. Cocaine's effects on the endocrine system are complex and far-reaching, impacting everything from stress response to sexual function. One of cocaine's most significant endocrine effects is its impact on the hypothalamic pituitary adrenal (HPA) axis, the body's central stress response system. Cocaine use activates the HPA axis, leading to a surge in stress hormones like cortisol and adrenaline. This chronic activation of the stress response can have detrimental effects on overall health, increasing the risk of anxiety, depression, and cardiovascular disease. Cocaine use can also disrupt the production and regulation of other hormones, including testosterone, estrogen, and thyroid hormones. These hormonal imbalances can contribute to a range of problems, including sexual dysfunction, infertility, and menstrual irregularities. Section 8. Reproductive risks. Cocaine's impact on fertility and pregnancy. Cocaine use carries significant risks for both male and female reproductive health. In men, cocaine use can lead to decreased sperm count, reduced sperm motility, and abnormal sperm morphology. These effects can make it difficult to conceive and may contribute to infertility. Cocaine use has also been linked to erectile dysfunction and a decreased libido. For women, cocaine use can disrupt the menstrual cycle, making it difficult to track ovulation and conceive. Cocaine use during pregnancy poses serious risks to both the mother and the developing fetus. Cocaine can cross the placenta, exposing the fetus to its toxic effects. This can lead to miscarriage, premature birth, low birth weight, and birth defects. Babies born to mothers who use cocaine during pregnancy are at increased risk of a range of problems, including developmental delays, learning disabilities, and behavioral problems. These children may also experience withdrawal symptoms after birth, including tremors, irritability, and difficulty feeding. Section 9. A weakened defense. Cocaine and the immune system. Cocaine weakens the body's immune system, making users more susceptible to infections. Cocaine suppresses the activity of immune cells, including white blood cells, which are responsible for fighting off infections. This immunosuppressive effect makes it easier for bacteria, viruses, and other pathogens to take hold and cause illness. Cocaine users are at increased risk of a wide range of infections, including respiratory infections, skin infections, and bloodborne infections like HIV and hepatitis C. Cocaine use can also worsen the course of existing infections, making them more severe and difficult to treat. For example, cocaine use can accelerate the progression of HIV infection to AIDS. Moreover, cocaine use can interfere with the effectiveness of vaccinations, making users less likely to develop immunity to preventable diseases. This increased susceptibility to infections can have serious consequences for cocaine users, leading to prolonged illness, hospitalization, and even death. Section 10. Bone, muscle, and cocaine. A recipe for damage. Cocaine's damaging effects extend to the musculoskeletal system, affecting both bone and muscle health. Cocaine use can lead to a condition known as cocaine-induced rhabdomyolysis, a breakdown of muscle tissue that releases harmful substances into the bloodstream. These substances, including myoglobin, can damage the kidneys and lead to kidney failure. Rhabdomyolysis can also cause muscle pain, weakness, and swelling. In addition to its direct effects on muscle tissue, cocaine use can indirectly affect bone health. Cocaine use can lead to malnutrition and vitamin deficiencies, which are essential for maintaining strong bones. Cocaine-induced seizures can also increase the risk of fractures. Furthermore, chronic cocaine use has been linked to an increased risk of osteoporosis, a condition that weakens bones and makes them more likely to fracture. The combined effects of muscle breakdown, malnutrition, and potential for seizures create a scenario where cocaine use significantly elevates the risk of musculoskeletal injuries and complications. Section 11. Skin deep. Cocaine's visible and hidden effects on the integumentary system. Cocaine's impact on the integumentary system, which includes the skin, hair, and nails, is often overlooked. However, cocaine use can have both visible and hidden effects on the system. One of the most noticeable effects of cocaine use is its impact on the skin. Snorting cocaine can cause irritation, sores, and even perforation of the nasal septum, the cartilage that separates the nostrils. Injecting cocaine can lead to skin infections, abscesses, and track marks, which are visible scars along the veins. Cocaine use can also cause a condition known as cocaine bugs, a type of delusional parasitosis where users feel like insects are crawling under their skin, leading to excessive scratching and skin damage. Beyond these visible effects, cocaine use can also damage the skin's underlying structures. Cocaine's vasoconstrictive effects reduce blood flow to the skin, depriving it of oxygen and nutrients. This can lead to dryness, wrinkles, and premature aging. Cocaine use can also impair wound healing and increase the risk of skin infections. Section 12. A body under siege. Understanding the full impact of cocaine abuse. Cocaine's allure, often portrayed as a glamorous escape, masks a sinister reality, its profoundly destructive effects on virtually every system in the human body. From the initial surge of euphoria to the devastating crash and the long-term consequences that can linger for years, cocaine exacts a heavy toll. Understanding the full scope of cocaine's impact is crucial not only for those struggling with addiction, but also for their loved ones, healthcare providers, and society as a whole. This knowledge can empower individuals to make informed decisions about their health, seek timely treatment, and support others on the path to recovery. Breaking free from cocaine's grip requires a multifaceted approach that addresses the physical, psychological, and social aspects of addiction. By recognizing the profound and interconnected ways in which cocaine harms the body, we can better equip ourselves with the knowledge and resources needed to combat this devastating epidemic.